Greetings and welcome to Ndumberi, Kenya. This agricultural town of 18,000 people is a host to many tea and coffee farmers, but it's a very poor village. Located just 15 miles north of Nairobi, a town of 4 million people, this community did not really have access to any clinical or medical facilities until Genesis World Mission was able to help PEFA Mercy Medical Centre establish this clinic. I'd like to show you around on the inside. PEFA Mercy Ministries established the Mercy Medical Center here in 2007 with the generous help of Genesis World Mission, Hands of Hope, Compassion International, Eagle Nazarene Church, Capital Christian Center, and many other believers and individual supporters. I'm sure that if you had a chance to visit here, you'd recognize this center of excellence that this clinic has become, and I'd like to show you around inside. Well, as you would expect in a medical clinic, the facility has a variety of rooms that were established to care for patients. So, for example, this is a medical exam room that's equipped with a table, as well as ultrasound equipment that was sent over by Hands of Hope. And this equipment is hopefully going to be used at some point in the future for maternal services. Right now, pre- and antenatal services are provided by the clinic. A procedure room is also available for such simple things as sutures, injections, and other simple procedures that would be useful for people in this community. This year, the clinic has been able to establish an immunization center. Immunizations are provided by the government at no charge, but this allows the clinic to be able to promote its services and gain a customer base so that these people continue to come back. So if they get sick, they already know about the facility and the excellence offered here. The reception room is a very busy hub of activity here at the PEFA Mercy Medical Center because almost 80 patients a day are cleared through this facility. Starting in 2007, they were seeing on average about 35 patients a day, but the number has quickly risen because of the excellence that had been provided here. And as you can see, if you were to look all over this room, they have a new problem, and that is space for medical records. In these charts alone, we have over 1,700 patients, but if you were to look in every single nook and cranny in this room, down below the cabinets on the other side, and then inside this cabinet, you can see they've had to go to a much simpler paper filing system as they established more and more patients every single day. The clinic provides centralized lab services. The African model normally is to go to a doctor, get a order, go to a lab, go back to the doctor, go get your prescription elsewhere. But because of the centralized laboratory facilities, all of this is provided under one single roof, providing for great efficiency and much more convenience for the patients. Well, we found our way to the pharmacy where a lot of patients are receiving a lot of prescriptions. Again, a very convenient thing for them instead of going back and forth between different places. The pharmacy here dispenses drugs that treat kind of your run-of-the-mill African issues, hypertension, dysentery, respiratory issues, and of course, malaria, which is one of the leading causes of death in this region. We are really glad to be able to open up the dental facility here in April 2009. Dr. Abraham came on board as the oral care officer, and already they're beginning to see patients here. With the help of KTSY, Patterson Dental, Hugh Freed, and other donors, we're now able to provide some very quality dental care. Thanks for joining us on this tour of the PEFA Mercy Medical Center in Ndumberi, Kenya. We really want to thank all those supporters and organizations who help make this project possible and continue to work with us in this support. And we hope that you'll continue to support us as we look at other places to help express the love of Jesus Christ by meeting the medical, physical, and spiritual needs of the less fortunate, both locally and abroad. Thank you.